How to treat a snakebite like a pro. Subscribe for more videos. Treatment for a snakebite should begin immediately after the bite occurs. The following steps should be taken. Call for emergency medical assistance immediately. Keep the affected limb immobilized and at or below the level of the heart to slow the spread of venom. Clean the bite wound with soap and water. Remove any constrictive clothing or jewelry near the bite wound, as swelling may occur. Do not cut the bite wound or attempt to suck out the venom. Do not apply ice or a tourniquet to the bite wound. Do not attempt to capture the snake or try to identify the type of snake that bit you. If possible, try to remember the color and shape of the snake's head, as this can aid in treatment. Keep the person calm and at rest to slow the spread of venom. Administer first aid, such as cleaning the wound and keeping it immobilized, until medical help arrives. Monitor the person's vital signs, including breathing, pulse, and blood pressure, and be prepared to administer CPR if necessary. Administer antivenom, if available, as soon as possible. Transport the person to a hospital for further treatment and observation, as some snake venom can cause delayed symptoms. It is important to note that not all snake bites are fatal, but it is essential to seek medical help immediately, especially if the person experiences symptoms such as difficulty breathing, blurred vision, or severe pain. In addition, it is important to be aware of the types of snakes in your area and to take precautions to avoid snake bites. This includes staying on designated trails, avoiding tall grass and underbrush, and wearing protective clothing and boots when hiking or camping. If you live in an area with venomous snakes, it is also a good idea to have a snakebite kit on hand, which should include a cell phone, a first aid kit, and a compression bandage. Once again, it is very important to seek medical help immediately after a snake bite and to follow the steps outlined above to provide first aid and slow the spread of venom. It's also important to note that not all snakes are venomous and not all venomous snakes are dangerous. Many snake bites are dry bites, where no venom is released and the severity of the bite is less dangerous. It is also important to note that there are different types of venom and different snakes have different venom compositions. Some venomous snakes can cause localized effects such as pain, swelling and redness at the site of the bite, while others can cause systemic effects such as blood clotting disorders, kidney failure, and muscle paralysis. The best way to prevent snake bites is to be aware of the types of snakes in your area and take precautions to avoid them. This includes staying on designated trails, avoiding tall grass and underbrush, and wearing protective clothing and boots when hiking or camping. It is also a good idea to take a snakebite first aid class and carry a snakebite kit with you when you are in snake-prone areas. This kit should include a cell phone, a first aid kit, and a compression bandage. In conclusion, snake bites can be serious and require immediate medical attention. It is important to stay calm and call for emergency medical assistance immediately. Keep the affected limb immobilized and at or below the level of the heart. Clean the bite wound with soap and water, remove any constrictive clothing or jewelry near the bite wound, and do not cut the bite wound or attempt. Do not forget to subscribe for more new videos.